Hello and welcome back to another MedRevisions video. Today we have an August 2021 recall question that we'll be breaking down and that will hopefully help you in the upcoming PLAB 1 exams. Alright, let's get to it. Before we discuss the question, please take 50 seconds to pause the video and comment the answer down below. Alright, now let's get to the question. We have a 75-year-old male who is a resident of a nursing home who presented to the GP surgery with a complaint of widespread itching for the past week that is worse at night. On examination, there's an itchy scaly rash with linear erythematous lesions on his finger webs and wrists. He is allergic to chrysanthemum. What is the single most appropriate treatment? Okay, so the correct answer here is 0.5% malathion aqueous liquid. Okay, before we discuss the question further, please hit that like button so that can help us help you. And also don't forget to check out our reviews that we got from our past PLAB 1 candidates. The link is in the description below. And also make sure to check out our PLAB 1 MedRevisions platform where we have high yield questions as well as some rare questions that might come up in the exams. So make sure to get familiar with all those topics. Alright, so back to the question. As I said before, the correct answer is 0.5% malathion aqueous liquid. Now, why is it not permethrin? We will see why. So the diagnosis is scabies indeed, because the patient has widespread itching, especially at night. Now, it can be prominent after a warm bath, especially at night. Now, they will have white linear lines that show the mites that are burrowing between the web spaces and also on the areola of the female breast and male genitalia. Now, normally the first line treatment would be permethrin unless permethrin is contraindicated or not tolerated, such as in this question stem where the person is allergic to chrysanthemums. So that is why we do not give permethrin, we give malathion liquid. Alright, so 0.5% permethrin is not given. Try to avoid these mistakes by spending an extra few seconds carefully looking at the answer options. Once again, this patient is allergic to chrysanthemums. That is why we do not give that. Okay, so it should be 5% permethrin if it is the correct answer and not 0.5%. Okay, so do not get those mixed up either. Now, why not doxycycline? Doxycycline is not indicated in scabies treatment. So why not reassure? Reassuring is not the correct answer because all scabies patients and all the contacts should be treated immediately because it can spread very, very fast. Okay, so that rules out all the options, and we know the correct answer is malathion aqueous liquid. Alright, I hope that question was clear to all of you, and we'll see you in another video. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.